Okay, good afternoon, everyone, and welcome to this webinar. My name is Nathalie Percie de Sert, and I'm Head of Experimental Design and Reporting at BNC France, and I also led the work on the revision of the RAB guidelines. So today, I'm going to give you an overview of the RAB guidelines 2.0, and I'll explain why we revised them, and I'll highlight the main changes. I'll also cover the importance of reporting the information included in the guidelines, and how that contributes to the reproducibility and the reliability of animal research. So I'm sure most of you are now familiar with Zoom. If you have a specific question during the webinar, please feel free to send it over using the Q&A function, and I'll answer all questions at the end of the presentation. Please do not use the chat function for questions. We will only look at the questions coming through the Q&A. So this webinar is being recorded, and we will post a presentation on the RAB Guidelines website after the meeting. So I'm going to start by presenting the guidelines. So the RAB guidelines were developed to improve the reporting of information in animal research publications. They were originally published in 2010, and they have been revised for the last few years. The updated guidelines, RAB 2.0, were released in July 2020. The guidelines consist in a checklist of items that have to be included in the manuscript to ensure comprehensive and transparent reporting. So all these items are important for different reasons. They can be important for internal validity. For example, a description of the study design, how the animals were allocated to groups, and how the sample size was chosen are crucial information to understand how reliable and robust the findings are. Some of the items are important to ensure that papers contain enough information to repeat the studies that are described. So for example, a comprehensive description of the experimental procedures or the animal characteristics. And other items provide information about the context and the scientific relevance of a study. For example, the scientific backgrounds, the relevance to the species, or the ethical approval. And these guidelines apply to all in vivo research, whether using a mammalian species or an invertebrate. It doesn't matter if the species used doesn't require ethical approval. The guidelines are about rigorous science, so that applies to any experiment. The RAB guidelines are endorsed by many of the major stakeholders in scientific research. So over 1,000 journals recommend the guidelines and instruction to others. And in the UK, all research councils and major biomedical research funders were early adopters. They made reporting publications in accordance with the RAB guidelines a condition of funding, and they were also instrumental in getting the universities on board. Today, many funders and universities recommend the use of the guidelines and have released public statements of support. And there's also grassroots support from the researchers themselves. So over the last few years, we've had 40,000 requests for printed copies of the guidelines from 50 different countries. And to explain why we developed resources like the RAB guidelines and why they are needed, I will use an example of the reproducibility project in cancer biology. So that shows that for research to be reproducible, it needs to be fully reported. So that project was set up and began in 2013 following reports from the pharmaceutical industry that 80 to 90% of published research could not be reproduced. The project has already published replication results for 16 of the replication studies in the journal eLife. And the bottom line is next. Most studies reproduced part of the original papers, but also reported some results that were not consistent with the original papers. But what I want to draw your attention on is the number of papers to be replicated. So the study initially set out to replicate 50 experiments, and that target was reduced to 37 papers in 2015, then to 29 papers in 2017, and in July 2018, a decision was taken to reduce it to just 18 papers. And that decision to cut off some of the replications was taken because cost and resources was spiraling out of control. And one of the main reasons for that was that methodological details were lacking from the original papers. So clearly there is a problem with reporting of preclinical research. And there are not enough methodological details in publications to enable other researchers to reproduce the experiment described. But another thing that's frequently missing from publications is information allowing readers to assess how reliable the results are likely to be. So this is a preprint which was published a few months ago. And in there, researchers used the SciScore software to analyze 1.6 million open access papers from PubMed Central. So the graph on the left specifically looked at papers reporting animal research and shows that for papers published in 2018, the percentage of papers mentioning the use of measures to reduce subjective bias is very low. Randomization to allocate to groups was mentioned in 37% of the publications, blinding in 12%, and power calculation in 7%. The graph on the right shows the evolution of the reporting of these measures over the last 25 years across all papers, so that also includes clinical research. And you can see that there has been some improvement over the years, especially for the reporting of randomization, which increased from 10% in 2000 to 30% last year. But the reporting prevalence of these measures is still very low, and this highlights a problem with the reliability of animal research and whether we can actually trust the results published in the literature. And the ARRIVE guidelines do not only help you report your research more transparently, they also encourage better quality research. So this is a study published by Hannah Werbel and colleagues in 2016. They conducted a survey of all in vivo researchers in Switzerland and asked detail about the conduct of animal experiments. So they specifically asked about 7 measures that are used to reduce the risk of bias. So these were allocation concealment, blinding, randomization, sample size calculation, and whether inclusion and exclusion criteria, the primary outcome measure, and the statistical analysis plan were defined before the study started. So participants were asked whether these measures were generally used in their own research and whether they had heard about the ARRIVE guidelines, and 50% said that they had. So they calculated an internal validity score for each participant based on these 7 criteria, and they found that researchers who knew about the ARRIVE guidelines scored higher. So there is an association between good practice in experimental conduct and the ARRIVE guidelines. And as we were preparing for the revision of the ARRIVE guidelines, we also gathered evidence from an international survey of in vivo researchers. And we identified researchers who had recently published in vivo research from PubMed and invited them to take part in the survey. So this had 2 objectives. First of all, we wanted to replicate the findings from the Swiss study and test whether knowledge of the ARRIVE guidelines is associated with more rigorous experimental conduct. And we also wanted to gather qualitative evidence on the use of the guidelines to inform the revision. And on the first objective and the association between the ARRIVE guidelines and experimental conduct, we got 356 complete surveys back for that section. 209 researchers had not heard about the ARRIVE guidelines or were not sure, and 147 were aware of the guidelines. And we did detect a difference, and we found that knowledge of the guidelines is associated with more rigorous study design. The effect size corresponds to the use of half an extra measure to reduce the risk of bias. And the main differences were seen in the use of exclusion criteria, predefined analysis plan, and the sample size calculation. So of course, this is a correlation, not a causation, but that's good news. And that shows that there might be benefits of reporting guidelines such as ARRIVE beyond just improving transparency of reporting. And in the next section of the survey, we tried to understand why researchers would not include information covered in the ARRIVE guidelines in their publications. So we asked about 13 pieces of information that we knew were often not well reported or poorly understood, so that we could gather qualitative data and assess what we could do to improve in the revision. So for example, we asked whether researchers reported measures to reduce bias or experimental design details, and crucially, if they didn't report it, the reason why. So this is a very high-level summary. This is also self-reported by the authors. And we know that the percentage of responders saying that they explicitly report the information are not representative of the prevalence rate in published papers, which is normally much lower. But what we were interested in was the reason for not reporting this information. So this varied depending on which ARRIVE items we were asking about, but the main reason for not reporting was that the author did not think it was necessary. And what this shows is that poor reporting actually reflects the perceptions and the attitudes of the scientific community rather than journal behavior. And that gave us a lot to work with in the revision, because if researchers don't understand what information needs to be reported, or they don't understand the relevance of reporting it when they pick up a copy of the ARRIVE guidelines, then this obviously limits the impact of the guidelines, and that needed to be addressed. So in ARRIVE 2.0, the main departure from the original ARRIVE guidelines is that we have reorganized the items and we've prioritized them into 2 sets. That's to allow a step-by-step approach in the implementation. So the ARRIVE Essential 10 are the basic minimum, the minimum requirements, the basic minimum to include in a manuscript, because without this information, reviewers and readers cannot confidently assess the reliability of the findings that are presented. So we know that journals don't have the capacity to check compliance with the entire ARRIVE guidelines. So here we propose an expert consensus on the information to prioritize. And this also promotes a harmonized approach across journals to ensure that all manuscripts contain essential information that's needed to appraise the research. And then there is the recommended set. So these items complement the Essential 10 and they add important context to the study. So reporting the items in both sets represent best practice. We've also updated the guidelines and we've added a few new items such as protocol registration and data access, which were not on the radar when the guidelines were first developed in 2010, but are increasingly recognized as rigorous practice. And a major part of the revision was also to develop an explanation and elaboration document, which was published alongside the guidelines in PLOS Biology. So the document explains the rationale behind each item of the guidelines and why it's important to report this information. It clarifies key concepts, particularly around experimental design and statistics, and it provides examples from the published literature showing how to report this information. There is a living version of this document available from the ARRIVE website so that it's easy to navigate, and we'll also gradually increase the number of examples for each item of the guidelines so that we can provide examples of good reporting in a wide range of model organisms and experimental settings. And these explanations are really useful for the design of animal experiments as well. So I really recommend that you read them before starting the study so that you can make sure that you are planning the study in a way that you'll be happy to report transparently, and also ensure that you're collecting all the information that you will need to include in the publication. Revising the guidelines has been an extensive and collaborative effort with input from the scientific community carefully built into the process. So this is to make sure that the guidelines are relevant to all in vivo researchers. And the revision has been undertaken by an international working group with expertise from across the life science community. So that includes funders, journal editors, statisticians, methodologists, and researchers from academia and industry. To allocate the items of the guidelines into the two prioritized sets, we used a Delphi exercise with external stakeholders to maximize diversity in field of expertise and geographical location. So we had experts from 19 different countries providing input. And following the publication on bioRxiv in 2019, the revised guidelines and the explanation document were also road tested with researchers preparing manuscript describing in vivo studies. So that's to ensure that these documents were well understood and useful to the intended users. And we've also considered other reporting standards as part of the revision to ensure that we didn't provide conflicting advice, which would be confusing to researchers. So ARRIVE 2.0 are compatible with other guidelines that have been published in recent years because they provide a comprehensive set of recommendations that are specifically tailored to the description of in vivo research. Using the guidelines, the ARRIVE guidelines to write a manuscript will actually help authors comply with the more general requirements and journal policies. So now I'd like to spend the rest of my presentation on the ARRIVE Essential 10 and explain why this information is important to include in the manuscript. So the Essential 10 include information about the study design and the sample size, but the sample size on its own doesn't mean anything if we don't know the experimental units. And it's not always straightforward to identify the experimental units. When reading a paper, it can be impossible to know for sure what the N number relates to. The experimental unit is the entity that the treatment is applied to, independently of all other units. So it must be possible to assign any two experimental units to different treatment groups. Sometimes the experimental unit is the animal, sometimes it's not. For example, you might be reading a paper reporting an experiment in fish. So there are 2 tanks with 10 fish per tank. The treatment is diluted in water so that a drug is added to one of the tanks and the vehicle is added to the other tank. Measurements are made on each of the fish so that there are 10 measurements per tank. In this case, the experimental unit is the tank and we have N = 1 per group. The measurements on each fish are not independent, so they should be averaged at the tank level so that each tank provides 1 data point. So being explicit about the experimental unit is really important because as a reader, you'd probably draw very different conclusions if you're looking at data with n equal 1 or n equal 10 in each group. The guidelines also insist on sample size justification, and you might be wondering why small sample sizes are such a problem here. But underpowered experiments really undermine the reliability of published findings, and I'm going to try to explain why. So the main parameters that are used in the power calculation are the effect size. That's the minimum difference you want the experiment to be able to detect. So normally that would be based on what would be biologically or clinically relevant. Then there's the variability, which is normally estimated based on previous experiments. But if you do not have this information, you can actually use a standardized effect size instead. There's the power, which is the percentage of true positive the experiment can detect. So a power of 80% means that when there is a real biological difference and you run the experiment 10 times, you'll get a statistically significant result in 8 out of 10 experiments. And then there's the significance threshold. So that's the probability of obtaining a false positive. If you set the limit at 0.05, it means that in 5% of the cases, you'll get a statistically significant result when there's no real difference. So now let's think of a scenario of 1,000 hypotheses to be tested in 1,000 experiments. So let's say that 1 in 10 of these hypotheses are true. So in 100 of these experiments, there will be a real difference to be detected. And in 900 of these experiments, there will be no difference to be detected. And we're going to run this experiment with 80% power. So in the experiments where there is a real difference to be detected, we're going to detect 80. So we'll get 80 true positive. So these are the light green square here. And 20 false negative results. That's the red one. Then out of the 900 experiments where there is nothing to be detected, because our significance level is 0.05, 5%, so 45 of these experiments, will give us false positive results. So that's the dark green square. So in terms of what we're going to see in the published literature, because we only tend to see the positive studies, in this scenario, we've got 80 true positive results and 45 false positive results. So out of 125 experiments that are going to be published in the literature with positive results, 36% are false positive. And that's just the way null hypothesis significance testing works, and because of publication bias. So this has got nothing to do with small sample size yet. This is just what experiments, this is what happens when experiments have powers of 80%. And the issue is that we know that in vivo studies are not normally powered at 80%. And this is a study that was published in Nature Neuroscience a few years ago, which looked at the sample sizes reported in the literature and found that many of the studies are badly underpowered. So the average power in neuroscience animal model studies was actually between 20 to 30%. The median was 21%. So now if we take the same scenario of 1,000 hypotheses and we run these experiments with 20% instead of 80% power, let's see what happens. So out of the 100 experiments where there is a true difference to be detected, we will only detect 20. So we'll have 20 true positive studies and 80 false negative. Then out of the 900 experiments where there is nothing to be detected, our significance level has not changed, it's still 5%. So 45 out of these 900 experiments are going to come back as false positive. So now, out of the 65 experiments that are going to be published in the literature with statistically significant results, nearly 70% are false positive. So that's why reporting how the sample size was decided is so important. And if your study is appropriately powered and the results are not statistically significant, the result can still be interpreted, whereas a negative result in an underpowered study is just inconclusive and it leads to research waste. The inclusion and exclusion criteria are also crucial information to include in the paper. So Scott and colleagues provide a very good case for it in their analysis of a common model of amyotrophic lateral sclerosis in mice. So this is a model that has shown poor clinical translation, as many treatments shown to work in mice do not show any efficacy in humans. So the researchers analyzed the historical database of animals that had been used as controls in efficacy studies to investigate the reason for this discrepancy. So the data set was quite noisy, there's lots of variation between animals, and they used computer modeling to explore this variation and identify what variables caused it. So they sampled animals at random and assigned them to groups. And by chance, they obtained differences in survival times between the groups, even though none of the animals had received any treatment. So this graph shows that the frequency at which group differences were seen depends on the sample size. The smaller the sample size, the higher the chances of seeing differences between the groups. So when the simulation was run with 4 animals per group, effects were detected in 55% of the time. With 20 animals per group, effect was seen in 25% of the time. So that's lower, but they're still quite high. But when appropriate exclusion criteria were applied, this frequency reduced drastically. When they excluded animals that died from non-ALS causes and those that did not contain enough copies of the transgene, at n equal 4, the frequency of apparent effect was reduced from 55 to 35%, and at n equal 20, it was reduced to less than 5%. So it's actually likely that published studies that had reported that the treatment worked in mice had actually detected noise rather than actual effect of a drug. The guidelines also insist on randomization and the method that was used to randomize. So when you allocate animals to treatment groups, the method of randomization is very important. Haphazard is not random, and you need to use a validated procedure to randomize animals into groups. So for example, a computer-generated list of numbers, throwing a dice, flipping a coin, essentially anything that you cannot subconsciously influence. And randomization has 2 main purposes. First of all, it helps minimize selection bias and reduces systematic differences in the characteristics of animals that are allocated to the different groups. So for example, with a haphazard selection, you may end up with the slowest mice allocated to the same group because that's just how you code them. The other thing with randomization is that it helps you meet one of the key assumptions of the statistical analysis that says that different groups should be drawn from the same background population using random sampling. So if you've not randomized animals into groups, then you shouldn't run a statistical analysis on data. And that graph here demonstrates the difference between haphazard and random. So this was a simple internet poll published in a blog on Cognitive Daily. Participants were asked to pick a number between 1 and 20. And the results are compared to a truly random allocation using the computer. So there were 20 numbers. So if it is random, each number has a 5% chance to be picked. And this is what the computer results show. The white bars oscillate around the 5% line. But when human participants picked a number at random, 20% of the people picked 17, and over 10% picked 7. So there might be a cultural explanation for these results, but the point is that human beings cannot do random, and the randomization needs to be done with a validated method that cannot be influenced by human judgment. The ARRIVE guidelines also recommend describing who was aware of the group allocation at different stages of the experiment. And this experiment in rats demonstrates why blinding is important. So the experiment was carried out by 12 students and involved 2 different populations of rats. There was a population of maze bright rats, which had been bred of many generations to perform well in maze tests. And there was a population of maze dull rats, which had been bred of many generations to perform poorly in this type of assays. The rats were put through a T-maze, which had a white and a dark arm. The dark arm was reinforced, so rats would get a reward and learned to go to the dark arm. After the training phase, the experiment was carried out over 5 days, and the students just counted the number of correct turns to the dark arm. So as you can see on the graph, the maze bright rats did significantly better than the maze dull rats. The bright rats started off better and they improved further during the course of the experiment. The thing is, the experiment was not performed on a rat, it was performed on students. There was actually no difference between the 2 populations of rats. They had been labeled bright or dull randomly in the morning of the experiment. So the only difference between the 2 populations of rats were in the minds and the expectations of the students who ran the experiments. The rats in the bright group were perceived as brighter, cleaner, tamer, more pleasant to work with. And the students working with the bright rat actually described their own behavior as more relaxed and casual. So these differences on the graphs here are due to differences in investigators' behavior towards the rats rather than the rat themselves. And that's why blinding is extremely important, because as a reader, if you don't know whether the students were blinded or not, you cannot interpret this graph. And we can see the impact of randomization and blinding in the published literature. So this is an analysis of 290 abstracts describing animal research and presented at meetings of the Society of Academic Emergency Medicine. So the analysis looked at whether the use of randomization and blinding were reported in the abstract and whether the study is reporting positive or statistically significant results. So the graph shows the percentage of abstracts with negative results, so statistically not significant results. And it shows that 1 out of 3 abstracts reporting both randomization and blinding had negative results. But in the abstract reporting only one of these measures, so either randomization or blinding, 1 out of 5 reported negative results. And in the abstract reporting neither measures, less than 1 out of 10 reported negative results. And that difference was statistically significant. Studies reporting neither randomization nor blinding were actually 5 times more likely to report statistically significant results compared to studies that reported both randomization and blinding. So what that means is that the results of studies that don't report randomization and blinding actually cannot be trusted because they're likely to be false positive. So, as I said earlier, the ARRIVE guidelines are reporting guidelines, but they are useful to consult throughout the course of a study. So first of all, during the study planning, the guidelines and accompanying explanation and elaboration document provide recommendation on experimental design, on minimization of bias, on sample size determination and statistical analysis. So that helps researchers design rigorous and reliable in vivo experiments. They're also useful during the conduct of a study, and this allows researchers to record important information about the study methods, which will be needed later for the manuscript preparation. They're useful when writing a manuscript, uses an end-memoir to ensure that the manuscript contains all relevant information. And they're also useful when reviewing a manuscript to ensure that all relevant information is available to evaluate the research. The new ARRIVE guidelines come with a new website that's dedicated to the guidelines and include many freely available resources. So that includes fillable author checklists. So these are used to indicate in which section of the manuscript the relevant information can be found. Some journals request this checklist as supplementary information with a manuscript submission. The checklists are available for the Essential 10 set only or for the entire ARRIVE 2.0 so that journals can tailor the requirements. The website also includes translations of the guidelines. So the original guidelines are available in 8 different languages. And that's particularly helpful for organizations in non-English speaking countries to disseminate the guidelines to researchers. And we're currently working on translation of ARRIVE 2.0. So ARRIVE 2.0 are currently available in French and German, and there's a Chinese translation on the way. And as I mentioned earlier, the website also includes all the explanation and the examples for each item of the guidelines. And you'll also find guidance for stakeholders, such as funders, journals, and universities, with advice on how the guidelines can be integrated into their workflow to improve the reporting of animal research. And in the next few months, we'll add new resources, including an operationalized checklist to assess the manuscript compliance with the Essential 10. So that is something that would be very useful to editors and journal staff. And that can also be used in the development of software that assess the reporting quality of publications automatically. So that's the end of my presentation. I'd like to thank the ARRIVE Revision Working Group, who are amazing to work with and did a brilliant job throughout this project. Further information can be found on the ARRIVE website at arriveguidelines.org, or you can email us at arrive@ncfrs.org.uk.